Because it's Black History Month, it's interesting for me to take this time to reflect about what it means to be an African American, a Black, female physician. And I think that I take very seriously the importance of my role, not just as a clinician that can better communicate to other Black patients, but also as a leader within, the health policy and kind of the medical community that's focused on equity issues. From the start of this pandemic, it became very clear that there were going to be a number of health disparities that were being exacerbated by COVID-19. And where I work, which is with a population that's predominantly Black, I saw firsthand just how serious those outcomes were because long-standing health disparities were, basically coming to light with these people who now were infected with COVID and doing very poorly because of their kind of baseline clinical status, which was impacted by a number of factors that they carried into the pandemic. And I think that that was discouraging for me as a physician of color and, as someone who thinks that, we needed to be doing a better job of addressing health disparities from before COVID arrived. I was a little bit, hopeful that the pandemic would help to steer better attention towards these health equity issues because it really unveiled a lot of the inequities in this country. And I do think a couple of things came out of that. For example, I found that myself included, there were a lot more physicians that were stepping up to the plate when it came to speaking to people and representing diversity within the healthcare workforce and communicating to different populations when we had things like, distrust of the vaccine when it came out or making sure that we're trying to get equitable distribution of all the treatments and services that were involved in COVID. And I think that we've made some progress. And I think that we are in a better position now than we were before. But I do think that, as a Black female physician, this has been a particularly trying time for me because I've seen how COVID-19 has ravaged communities of color and will really continue to do so. And the sequela of what happens, what is happening right now during this pandemic will be seen for years to come. And there's a lot of things that people have not even paid attention to that will impact the lives of individuals for decades. And I think that those are going to be things that I will continue to encounter as a physician that takes care of a predominantly Black community. And sometimes I don't have great answers when it comes to when, they're going to get a break or when they're going to get services that are focused on their needs or how I'm going to have better access to what I need to take the best care of the patients that I'm seeing. So, in general, yes, I think it's especially stressful to be a clinician and a physician on the front lines who's Black and taking care of people who in particular have been really, really hard hit by COVID-19.